Mike Johnson. I'm 67. I basically had fairly extreme pain in the joints in my thumbs. Well, I put up with it for about 6 months. Then I made an appointment with a surgeon to have them looked at and fixed. My first appointment was with one of the doctors, one of the orthopedic doctors at ORA. And I know his procedure is the standard procedure of cutting your arm open, taking a tendon out, removing the center bone here, and I think wrapping the tendon into that place so that when it heals or when it scars, it gives you some softness between the two bones. You know, fairly major stuff if your arm's cut open and your thumb's cut open. I was fortunate in that I got a good friend whose wife had had Dr. Cobb's treatment after the other one had left her still in pain. And we met and discussed it, and I just said, well, it sounds to me like I ought to try that first and forget about the gentleman that was going to do the other surgery. In the end, I had an arthroscopic CMC performed by Dr. Cobb. So rather than, you know, putting a different material in place of one bone, he just made clearance between the 3 bones that were the problem. My thumb was virtually normal in 4 weeks. There were 2 incisions here and here that you may or may not be able to see the scars, and there were 2 in front of those that literally the scars have disappeared. There would be no doubt whatsoever that I would recommend this to anyone that had problems with arthritis or degenerative cartilage in this area. It's so much less invasive than the old procedure, so to speak.